Question 25. How does manual circumlaryngeal treatment differ from myofascial release treatment? Boy, if you ask the purists, they're going to come up with a pretty distinct list of differences, especially if you're talking about a myofascial release therapist who views the work being done from a fascial perspective as this somehow beneath the skin, I can target fascia, connective tissue, to the exclusion of everything else and somehow select it for treatment. Manual circumlaryngeal treatment, the narrative is often that they're addressing muscle tension and reducing the tension, causing better positioning of the larynx and the hyoid, etc. What I'm looking at now is the newer papers that are out there that talk about the changes that we're making here, and whether it's with manual circumlaryngeal work or myofascial release or any kind of manual therapy or massage for that matter, the change is less about what we're doing directly to the tissue. And it's truly coming more from up here in the brain, the central nervous system, this patient's sense of perception and awareness, and all the higher centers of the brain, feeling the input, feeling the potential, feeling the stretch, if you will, and allowing a downregulation of tone, of tightness, or even higher brain center type of reactions that cause those changes in voice, in swallowing, in pressure, all the things that we think are due solely to tissue tension and all those other words that we use. So is myofascial release different from manual circumlaryngeal treatment? Classically, manual circumlaryngeal treatment is done in a more quicker way. I'm going to say more aggressive without being a negative word, right? It's done in a pattern to manipulate the laryngeal region. Myofascial release, or at least the way that I apply it, by the way, I call it myofascial release not because I think somehow I can target myofascia to the exclusion of everything else. It simply represents the style of engagement that I've used for the last 27 years, 28 years now, so I continue to call the work that I do and teach myofascial release. My work is slower. It's nuanced. If we hit an area of tension, of tightness, the perception of tightness that's perceived by the patient and the perception of tightness that matches some of their symptoms, I tend to hold, I tend to linger, I tend to hold the stretch, if you will. We're stretching without a doubt. What are we stretching? We cover that in some of the other videos that precede this one. But I think an advantage, in my mind, an advantage to the slow, nuanced approach is during the course of the evaluation and treatment, it allows my patient to experience, to feel, to see what it is that I'm replicating in them, and then it goes up to the brain. The brain allows or starts to process with a descending modulation of possibly a reduction in the severity of the symptoms. Manual circumlaryngeal work, the way I'm viewing it, we go in and we do the treatment, and then we let the patient perceive the changes later. Both are really effective. It simply becomes which one it becomes your home language, and myofascial release, the slow, nuanced engagement, to me is my home language. I don't view the two as being that dissimilar. Touch is touch. We can't target one tissue or one structure or even one pathology over another in manual circumlaryngeal work, in myofascial release work, in massage work, anything like that. In the way that we were taught, we're we're impacting the patient's skin, and the movement, the touch, the pressure is provoking input up to the brain for processing, for awareness, and hopefully the change then descends back down into the area of dysfunction. So, long answer for a short question. I don't see a lot of difference between the two.